Your recovery will occupy most of your time. Be as active as possible when you return home. The more active you are, within safe limits, the faster you will recover. When you have a new knee or hip, your first instinct may be to protect your surgical leg. This will not help you achieve your goal. To return to a walking pattern that is as normal as possible, you must use both legs, not just your good one. A walker will help you maintain your balance and take some weight off your surgical leg. Each day, use the leg with the new joint more and more. Stand in the middle of the walker. Shift your weight toward your non-surgical leg. Gently glide the walker forward. Push down slightly on the walker to support yourself as you pick up the surgical leg and place it in front. Place more weight on the walker using your arms as you step onto your surgical leg. Bring your non-surgical leg forward so your feet are side by side. As you improve, you will take larger steps with your non-surgical leg. Always keep your body within the walker frame. Keep your head up and your buttocks tucked in. Normal walking involves this sequence of movements. Push off your toes. Bend your knee as you bring your leg forward. Put your heel down first before you shift weight onto your leg. Instead of one long walk, take a short, frequent walk of 100 to maybe 400 feet. Each might take 5 to 10 minutes. Each day, walk a little farther or for a few more minutes. Approach the curb and get close to the edge. Place your walker up onto the curb. Step up with your non-surgical leg, up with the good. Next, step up with the surgical leg. Stand near the edge of the curb. Put your walker down onto the lower level. Step down with the surgical leg, down with the bad. As you step down, put some weight using your arms onto the walker. Then, step down with the non-surgical leg. To sit, walk backward with your walker until you feel the chair touch the back of your leg. Then, grasp the armrests. Lower yourself into the chair, keeping your surgical leg straight in front of you. Once you are firmly seated, slide back until the chair supports your back. To stand, follow these steps in reverse. To make getting on and off the toilet easier, consider adding these simple aids for your safety and comfort. A toilet with safety rails, a toilet and commode frame, or a toilet with safety rails and a raised seat. To sit on a toilet, follow the same steps as sitting in a chair. Walk backward with a walker until you feel the seat touch the back of your leg. Grasp the armrests, lower yourself into the seat, keep your surgical leg straight in front of you. To stand, simply follow these steps in reverse. If you have a bench that extends over your tub, slowly turn your walker and then walk backward until you feel the chair touch the back of your leg. With one hand on the walker, reach with your other hand to the chair back and slowly lower yourself into the chair, with surgical leg straight in front of you. Once you're seated, scoot further into the chair and use your leg lifter to assist with swinging your leg over and into the tub. Use a long-handled sponge to assist with showering. When you have completed showering, exit the tub by performing the steps in reverse. For an in-tub chair, it is safest to have grab bars accessible in your shower to safely enter the shower. Park your walker adjacent to the shower and reach for the grab bar with both hands. Step over the tub one leg at a time. While holding onto the bar, reach for the seat with the other hand and lower yourself into the chair, keeping your surgical leg straight in front of you. Exit the tub by performing the steps in reverse. You can get in or out on either side. Keep your walker near your bed. You may support your surgical leg with a leg lifter when you move from lying down to sitting on the edge of the bed. Silk or satin nightwear and sheets make these movements easier. You can hold onto the bed rail when you get in or out of bed. Before you get into a car, have your driver make sure the passenger seat is pushed all the way back and fully reclined. A handy bar can be used in your door frame for ease of lowering yourself down into the car seat. Otherwise, use the seat as support to lower yourself into a semi-reclined position. Slide back and pivot on your bottom to point your body and legs toward the front of the car. It is helpful to place a garbage bag on the seat to improve ease of getting in and out of the car. To get out, practice these steps in the reverse order, making sure you scoot to the edge of the car seat before standing up. When your doctor or therapist says you are ready, you may switch to a cane. Hold the cane in the hand opposite your surgical leg. For example, if the right hip or knee joint was replaced, hold the cane with your left hand. Slightly bend your elbow. When you walk, the cane and your surgical leg should swing and strike the ground at the same time. To start, place your cane tip about one small stride ahead. Move your surgical leg forward as you press on the cane. Do not lean too hard. Use gentle pressure on the cane. Finish the step with your normal leg, then repeat. Cane and surgical leg forward first, then follow with the normal leg. At first, you will move one step at a time. When someone is helping you, ask your helper to stand below you. Hold the handrail. Step up with your non-surgical leg first. Up with the good. Bring your surgical leg and cane up at the same time. Repeat this pattern one step at a time. When going downstairs with a cane, hold the handrail, take one step down with your surgical leg, down with the bad, and cane at the same time. Step down with your non-surgical leg, and repeat this pattern one step at a time. Use your cane until you can walk without a limp. You may need it for a few weeks or even months. Pain should be expected as a part of your recovery, especially with the rehabilitative exercises. However, if your pain becomes unbearable, you may need to call your surgeon's office. If pain or swelling increase, you are too active.